Welcome back, class. We're going to spend just a few minutes talking about healthcare ethics, and I guess public policy is kind of a general statement when I'm talking about it. And typically, as I've talked about in the past or mentioned before, public policy usually comes into a market economy, healthcare, restaurant business, whatever the market, automobile, whatever the market economy is, when it appears or they have the perception, government policy has the perception of market failure. And typically, or at least what we see a lot of in healthcare, it's market failure with respect to equitable allocation of healthcare goods and services because of socioeconomic issues. And we've had it in the past with with an older population on the Medicare side. Again, Arrow's article, if you believe most economists, it drove the establishment of Medicare. You've had the buildup of Medicaid and the expansion of Medicaid over the last few years in different states, and the liberal view when it comes to public policy is insufficient income and earnings opportunity is what's driving these issues. And public policy will go about implementing strategies to increase budget outlays for social programs, things like welfare, training, educational programs. You see it especially with food stamps, or I guess they don't call it food stamps anymore, but they have these EBT cards that they are loaded on a monthly basis and can provide the funds to buy healthy groceries. You've got WIC program with women infants, but it's for families with either pregnant women or pregnant or women with newborn babies to provide additional food and substance for the family. And you've also got Medicaid, where it's for the most part it's going to be free health care for the Medicaid if you qualify for the Medicaid program. And then now we've got the illegal aliens or illegal immigrants, depending on what terminology you want to use, coming in over the southern border, and I guess to a lesser extent coming in over the northern border, but mostly the southern border. And now that it is a public policy trying to take care of them, and at both the federal and state level, got these sanctuary cities, and it is generating a significant drain on the healthcare system, on the infrastructure of the healthcare system. And again, like most public policies, they're failing miserably. They tend to not help those populations that need the help the most, and it's pretty much a failure. And so that's on the liberal view. If you look at the conservative view, it's a breakdown of family values. Government as a significant contributor to social pathologies. Feminization of poverty with government incentives driving this lifestyle. I think that you've got the liberal view and you've got the conservative view, and the real factor is somewhere in between. But you've got these polar opposites setting out here, and if you could get them into the middle somewhere on public policy, we might be able to develop and implement public policy, especially in the healthcare marketplace, that's going to provide cost-effective, high-quality healthcare to this consuming population. Another thing that we see, from time to time, let's say, it's a misuse of grants and funds for the disenfranchised. Okay, so you have a policymaker and you've got somebody, it's a senator, House of Representatives, they get a bill passed, and you talk about the pork and all of these bills that are passed, and they've got grants and they're flowing grant money down to the state level, maybe to their constituents, and the money is being misused, it's being misallocated, and the disenfranchised that should be receiving these assistance payments, let's call them assistance payments, that should be receiving these assistance payments, it's not actually reaching the individuals that need it the most. And as I said, it's on the when we talk about public policy, it's a drain on healthcare resources. Um, it's significant impact to access of care, and it's of quality of care. I mean, again, it goes back to, and it's not just me that's having problems. A lot of individuals that I know are having problems accessing the healthcare system. I call on a Monday, need to see my physician. I can't see him. Friday's best we're going to do. And I hear this scenario time and again, and it's happening on a frequent basis, and it's because the infrastructure of our healthcare system is being overutilized, overloaded, overworked, and a lot of it is, especially if you're in areas where this the illegal immigrants that are coming in, they are just because they may not have had any health care services in the past, and it's taken a lot to get them up to speed. So, public policies, they may have initially the right mindset, but it's somehow along the way, the policies are not structured in a specific way and they can't be executed in a certain way to ensure that the needy that the policies are structured for are actually receiving the dollars. Also drives increased cost and ineffective treatment protocols. You talk about you want to talk about asymmetric and inaccurate information. With a lot of these individuals that are trying to seek healthcare services, there could be a language barrier. And so they don't understand the questions they're being asked, and they're providing incomplete information. And especially from maybe the countries that they came from, they have always been afraid to provide accurate information. So you end up with these ineffective treatment protocols, and all of this in combined is going toward that 25% of the waste and abuse that I talked about in one of the first segments of this module. And then lastly, it's the misuse, especially in public policy, it's a misuse of healthcare information. It's the impact on HIPAA protocol and procedures. It's just, for whatever reason, public policy, and again, I think it goes back to those normative statements. Here's what it should be, here's what it ought to be, and the government thinks that they know what we as consumers need when it comes, with respect to our healthcare goods and services, and with respect to managing our health status. And I'm not always sure that they do. We're going to take a quick break, and we're going to come back and talk about the providers in just a second. Talk to you soon.